What are the problems with Ca-19-9 blood tests for pancreatic cancer? Imagine trying to find a tiny needle in a big haystack. That's similar to what doctors face when using the Ca-19-9 blood test to detect pancreatic cancer. While it can be helpful, it has several important limitations that can make diagnosis tricky. First, the test isn't perfect at catching all cases. Its sensitivity is around 80%, meaning it misses about 1 in 5 pancreatic cancers, especially early or small tumors. That's a big gap when early detection is so crucial. Plus, the test's specificity is limited, often giving false positives. Elevated Ca-19-9 levels can happen in many benign conditions, not just cancer. For example, pancreatitis, gallstones, liver cirrhosis, and even some infections can cause higher levels, which can lead to confusion and unnecessary worry. Another challenge is that Ca-19-9 can't reliably tell if a pancreatic problem is benign or malignant. Many benign pancreatic conditions, like pancreatitis or cysts, can cause elevated levels, so a high result doesn't necessarily mean cancer. This makes it hard to use the test alone to make a diagnosis. Additionally, some people don't produce Ca-19-9 at all due to genetic factors. About 5 to 10% of the population lack the Lewis antigen, which is necessary for the test to detect the marker. If they have pancreatic cancer, their Ca-19-9 levels might stay normal, leading to false negatives. Biliary obstruction is another issue. Conditions like bile duct blockages, which are common in pancreatic cancer, can artificially raise Ca-19-9 levels. This can make it seem like the cancer is more advanced or aggressive than it actually is. The test also isn't useful for staging or deciding if surgery is possible. While higher levels might suggest more advanced disease, they can't replace imaging scans or other clinical assessments. Despite these problems, Ca-19-9 can be useful in certain situations. It's often used to monitor how well treatment is working or to check for cancer recurrence after surgery. But it's important to remember that it should never be used alone to diagnose pancreatic cancer. Doctors always interpret Ca-19-9 results alongside imaging studies, physical exams, and other tests. In summary, the main issues with Ca-19-9 blood testing are that it can give false positives and negatives, can be elevated in many benign conditions, can't distinguish between benign and malignant disease, and is affected by genetic and biliary factors. That's why it's just one piece of the puzzle, not the whole picture. Always consult healthcare professionals for a comprehensive evaluation tailored to individual circumstances.